Hello, everyone. Welcome to the Nurses Heartbeat podcast. My name is Philip, and I'm your host. I am joined today by Mike. Hello, Mike.
Hello, Philip.
Good to see you.
Good to see you. You're looking great, Philip.
Yeah, you are doing well as
Yeah,
well.
thank you very much.
I see. So we are having another episode of our podcast session. Today we are looking at burnout.
Burnout.
So, at work we go through a lot. Many people are saying, oh, there is a lot of stress, burnout. We want to dive a bit deeper into it today.
All right.
Okay. So when we talk of burnout, what actually do we mean?
Burnout. So in my layman terms, I say it's a series or a cluster of symptoms maybe people exhibit at the workplace when they feel exhausted, when their stress levels are not managed properly. They go through a cycle of events that manifests itself in different ways. Some even cry. Some people exhibit in the form of anger. And so, yeah, if you're asking me burnout, that's my layman explanation to burnout. Yeah.
Then I think there is a lot of these burnouts nowadays at work. In the NHS, we are both nurses, so there is a lot of stress and exhaustion.
I think when you the moment you step your feet in the premises, you realize that you've entered into a different zone, your main business, and your stress level shoots to quite a high level. And so if mechanisms are not put in place, you will find yourself wondering, am I really supposed to be here? Am I have I prepared myself enough to be here? Because actually it's not a playground at all. So it comes with its level of stress that I think is very good to talk about it and see the way forward, how this could be managed, so that we can continue to deliver the best care that we deliver to our clients.
Yeah, sure. So as you started and you were talking about some of the signs that shows someone is having or experiencing burnout, I think one of these common signs is people feels physical symptoms like illness as well. Some people may have some headache. Me personally, when I'm very much stressed.
So you've been burnout before?
Oh yes. I think that the number one manifestation when I am experiencing burnout is headache. I normally get headache, and then some people may have stomach issues.
Okay.
And when you are burnout, you are not very strong to do work. You feel like you've not been very efficient in the things you do.
Yeah.
Some people, as you said, results in anger and frustration. If in a typical day you meet a nurse at work who is experiencing burnout, you are not careful, you might even think the person is not having a good character or something.
Yeah.
But maybe it's burnout is too much exhaustion and stress.
Yeah.
This is quite common in our profession, in the healthcare setting. 12-hour shift and all of that.
Yeah, 12 hours is quite a long time to be on your feet with that amount of, I don't know, how many hours do you normally take for break at your workplace?
So break is 30 minutes.
Okay.
So you can have some tea or coffee aside that, but the main break you have 30 minutes.
Okay.
So for me, I normally take it around 2-3.
Okay.
So imagine going to work for 12 hours, you have only 30 minutes to have your break, and then you are going up and down.
No rest, no sitting. I think we normally have an hour break. You can split it into 2 halves.
Okay.
So normally if you go to work and you have not kind of eaten, people tend to take early breaks and then carry on with the work. So due to the stressful nature of the job, as we said earlier, it comes with burnout, and just as you say, people begin to feel headache. People begin to have stomach upset, sometimes mentally, emotionally, um, things begin to go haywire.
Exactly.
But I believe when you are able to know when you are stressed, you'll be able to find a way out, because people say a problem well defined is half solved. So at every point in time, we need to study our body to know when we are not well, we are not all right. And
Yeah.
I think the work culture at my workplace, although we face a lot of stress, people go out of their way and ask you, "Are you all right? Are you
Yeah,
okay?"
sure.
I remember a time my manager even offered me a cup of tea, and it was lovely. It took almost all my
Oh,
stress
that's
level away.
yeah,
So when it
sure.
happens, like when you have a supportive team, you realize that although you are working, you feel like you've still got more energy to
More
carry
energy.
on.
Yeah, sure.
Yeah.
We will come back into how we'll be able to manage this
Okay.
burnout later. But as you said, those are you okay thing is a thing in the
Yeah.
healthcare system, and I think it's very good thing.
It's a good thing.
Um, let's look at some of the causes of burnout. So
Mm-hmm.
me, I think one of the major cause is the long shift system that we have.
Okay.
The 12-hour shift, you go, like I go, have to report 7, and
Okay.
then I will finish 7 in the morning if I'm
Mm.
doing day shift, and I will finish half 7 in the night. So imagine you are working 12 hours, 12 and a half if you want to include the
The
break
breaks, yeah.
hours. And then yeah, I can imagine even yours that you have 1 hour, you might be
Mm.
working like 13 hours.
Yeah, roughly 13 and a half.
Yeah.
Yeah.
In my previous trust,
Mm.
yeah, it was the same thing. We had about 1.5 hour break,
Okay.
so we're doing over 13 hours.
Okay.
And it's so long, so I think that
Mm.
is one of the main cause
Yeah,
of stress.
I think so too. But on the flip side, people tend to choose this particular shift pattern only because when you work 2 3 days, it's able to fulfill your contract hours and you have the
Yeah.
rest of the weeks just for yourself. Other than that, if you want to split them into two halves, it will mean you have to be going to work every day, and probably you end up not having a full day for yourself. So again, whilst it's a good thing, people tend to get their contract hours done and dusted and then get back to
They
their
are
normal
able to
life.
do,
Yeah.
yeah. So
On the other side, I'll also say staffing levels can also
sure,
yeah, cause burnout, because
very important.
if you are looking at patients who are who really demand a lot of care, and your staffing level is not quite strong, or if you're short staffed, which has always been the case with the NHS, you
Exactly.
end up being stressed or being burnout. Again, if you've not planned your day really well, for instance, you're coming to work, you've not come with the workplace with food, enough water to drink.
Sure.
Um, yeah, if you're not in your right mind, you've not psyched yourself for the job, and you've got divided attention, um, you can be stressed. You can really be stressed. Yeah.
Exactly.
Mm.
And I also think that administrative work is also one of the major causes.
Yeah.
So there is a lot of documentations, there is a lot of bureaucracy, things you have to follow to do certain things in a certain
Mm.
way.
Yeah.
Electronic records,
Oh, that's one thing. Yeah.
updating stuff, care plans, and all of that. You
Yeah.
have a lot of things. In my trust, we do a lot of paperwork as well.
Yeah.
So you write here, you write there, and you do few computers
Yeah.
as well. These things I
Yeah.
think also consumes a lot of energy
It does
and
consume
time.
both energy and time. So can we also say that not having our priorities right can make us burn out, because there is always a lot
Yeah,
of things to
sure.
do. Sometimes if you are finishing your shift, you feel like you've done literally nothing.
Yeah.
It looks like you're going to hand over all the job to, but that is what nursing job really is, because those who work in the acute care setting is a 24-hour care. You can't do everything.
Exactly.
But getting your priorities right really save you a great deal of stress.
That's right.
So that you don't become easily burnout. Yeah.
Yeah.
So knowing what to do at what point in time, what is really, really necessary, and then organizing your work area also can not organizing your work area. So if you're working in an area where it's very difficult to find things, looking for medication, it can take you hours to find. It can also contribute to staff being burnt out. Yeah.
Very true. Now there is one thing that it's, should I say, frustrates me. Well, I feel bad about it. Sometimes you go to work and then the medication trolley you take to the patient bedside, and almost every tablet you take is an empty box.
Oh yeah.
You have to run back.
Oh, that's true.
Oh,
Yeah.
I really feel bad about it.
Probably that could be also one of the signs of burnout, because if you take medication pack out of the, if you take the out of the pack and you've used the last one, just bin the empty box.
Exactly.
But maybe they are in haste and they've even forgotten it's an empty pack. Then they package it nicely, put it back.
I think people also do it intentional.
Okay.
Because going back and try to sort it out, replace it, they think they don't have that time.
Okay. And but that's not a good thing.
Yeah, sure. And when that happens, it means that you have to sometimes be going
up and down,
and it's quite stressful. I hope my colleagues that are listening to us, and if there is anybody in that, for me personally, I normally try to replace some of the medication, but it's something.
I think in our case, the pharmacy staff normally come to inspect our we don't use trolleys in our place, just a lock, like a medication locker in different areas. So they come to take stock every day within the week, and then medications that have run out, they replace them. I think that's also that's helpful. Yeah, because if you have to do this yourself, you realize that you use most of your time to just sort these things out, which could have be invested in patient care. Yeah.
Exactly. When that support is there, having the pharmacists on the ward and they are trying to help.
Yeah.
They really help. There is one ward that I even know, in the afternoon the pharmacists help with medications. And that's very good. Not in my ward though. I think all those things. So if you get them coming to check the medications and stocking them, then it's going to help. Yeah. I wish every ward could have that.
Yeah, it's a good initiative.
Yeah, sure. Okay, so we want to look at some of the coping mechanisms very importantly. Because the burnout, the stress, they are always there.
Yeah, it's real.
They are part of our job. What are some of the things? Let's look at some of the ways that we can deal with this. I think you mentioned one of the points, prioritizing our duties. So we have to make sure that first things first, patient that needs the highest attention, giving the highest attention. We should really have a plan of how our day is going to be, so that it will help. I think it's one of the ways that.
I also think we need to know our patients and know what exactly they need and get an update at hand to give them when they ask you. Because if you are working with them and they ask you for an update, for example, relatives come and they ask you a question about, so what's next? You need to know exactly what is happening so that you don't have to be going back and forth with not getting them updates. Also, you don't need to give any empty promise. Just tell them exactly what is happening, because if you give them a timeline, for example, he says, "Oh, when am I going to see a doctor?" And he says, "Oh, in 5 minutes time."
5 minutes.
And the 5 minutes
They will
pass,
come after you.
and they've not seen the doctor.
Yeah.
So if the waiting time is, let's say, 10 hours, don't be scared. Just tell them it's 10 hours.
Sure.
Um, it can go up, it can go down, depending on what comes through the doors. And yeah, so again, we need to know how to manage patient expectations,
Sure.
so that they will not give us stress. Also, just as I said initially, with the coping mechanism, we need to keep ourselves hydrated, carry food, carry water,
Yeah.
come with drink, with sweets, at
Exactly.
least to get you going. When you eat some of these sweets, to give you energy, to get you going. If you drink more, you are able to hydrate your system and you don't feel tired, because the joint that moves going up and down, you are losing water, your kidneys might be crying, and so
Yeah.
as you hydrate your system physiologically, you are fit enough to carry on. Yeah, these are the things I want to touch on,
Yeah, sure.
to help us cope with the stress level.
Sure. And I think we should also look at balancing the work and home life.
Yeah.
Yeah, so we should be able to make proper plans when we are
Oh,
going to work.
yeah.
And as part of it, I think we should also be assertive. There are some people, some managers that they always want to ask you, like, when you are off, do you want to come to work, you want to do. I believe there are some people that we find it, especially from African background, I think
Mm,
some of us find it difficult saying no. So
mhm.
even if the person thinks that he is tired and needs some time at home, because the manager has asked, can
Yeah,
you work tomorrow, they want to come to work. And
yeah, that's very true.
yeah, I think we should be
Mhm.
assertive. If
Yeah.
you think you are exhausted, you cannot work, we should be able to say
Mhm.
we will not be able to do
Yeah.
that, so we can have some.
Just to buttress on your point,
Yeah.
for living like a balanced lifestyle, um, sometimes you can take a walk, you can go for a camping, you can go walking, just walking. I remember some time ago, one of my clinical educators invited me for a walk, and that was absolutely lovely.
Yeah.
We did a 5 hour walk. We
Oh,
also went for camping.
is it the one you walk from Warrington to Liverpool?
Although that was cycling,
That was like
that was cycling, yeah. But this
yeah.
particular, we went to is it Scaffell Pike, they call it. That's the highest
Okay,
peak in England. So we went there to camp there, and it was
interesting.
so beautiful. We see a lot of people walking. Some of them walk their dogs, coming batches to camp, and that was the time I had my best sleep ever. So I think we started the walk around 8 o'clock in the morning, and then around 4:30 we reached that Scaffell Pike. So we set up our tent.
Yeah.
There was a beautiful stream that was running. We fetched some, we filtered it, and we drank it. It
Yeah.
was so nice.
Yeah.
Around 5 o'clock, I was feeling so exhausted,
Mm.
and I went into my camp. Guess what? I woke up the next day around 6 o'clock. That was
Oh.
my best sleep ever.
Yeah, sure.
Yeah, so if you embark on some of these adventures,
It's
it
it's really,
clears your head space
yeah.
for you to accommodate everything. So yeah, you can take some time on your off day, just go around, go to the park, just walk, and then refresh yourself. Yeah.
Exactly. And probably my last point, I think the role of leadership is also important.
Mm,
Sometimes even our work roster,
yeah.
how it is scheduled, can also affect us.
Yeah.
If you get leaders that are able to make the roster in such a way that you
Mm,
have some time to rest and all of
yeah.
that,
Yeah. That's true.
I think leadership also
Yeah.
plays a role when it
Yeah.
comes to that.
And then also one thing I've realized is sometimes when you're working in an area, you feel like, no, I want to do this alone, I can do this, but you realize that you are struggling. Just ask for help.
Sure.
Asking for help
Very, very,
is
very
one of the things
important.
that will really help to ease your stress level. Because if you ask for help, help will come.
Help will come.
But if you don't, nobody will know you are stressing. And it's also a good practice to check on your colleague. You work as a team. If somebody is not behaving as he should normally do,
Yeah.
we owe a duty of looking after ourselves. Just ask them, are you all right? As you always do.
Yeah,
If you need to offer them a drink of water, a cup of tea, taking 2-3 minutes out of your time to do this will not impact your work negatively. Just go out of your way and help somebody who is also stressing. And I think with this, we can collectively look after ourselves and make our workplaces a healthy place to live.
Yeah, sure. Thank you.
Mm.
So let's ask for help, especially
Ask for help.
people that come. I am internationally educated.
So am I.
Exactly. And when you come into the nursing profession, when you are new, sometimes it becomes quite difficult asking for help.
It does.
But hey, that is what we have to do. Ask for it if you need it, and help will come. Yeah. Lastly, do you think in the future, now we are in the era of AI, artificial intelligence, do you think it's going to help anywhere in the future in releasing stress and burnout?
I think, in fact, technology is becoming more innovative now than ever before, and the health sector is no exception.
Sure.
So with the advent of AI, I don't know if you heard about virtual wards, where people are they are not there yet, but they are kind of fit in some way to go home, and then they are monitored remotely. So they just go home, give them some gadgets, give them machine, will be monitoring their blood pressure, monitoring their oxygen levels, and somebody somewhere will be sat beside the computer and be monitoring these values. And I think that will help to ease the pressure we have on these hospitals. And when it happens, it means that conversely, or in effect, some of the pressure will be taken off the staff as well. So the creation of virtual wards, the technology behind it, I think is a good thing. And then also we have robots that have been performing surgeries. And in fact, they are using a cutting edge technology, high accurate precision to carry out some of these surgeries, which are even more, efficient than humans. Yeah, so to say. So I think we are at the dawn of technology. A lot have been done anyway, but I think it's becoming insanely, crazy. Excuse my word, now than ever before. Yeah, so
so in my trust, sorry, they have rolled out this technology thing, AI for cancer treatment. So I think it's for cancer diagnosis, early diagnosis of cancer. So when they use that, I don't know much about it, but when they use that AI, it's able to quickly detect patients with cancer and all of that. I think they said they are piloting it. So it's new, they are doing it there. And some of these things are really going to help and bring some relief. So let's watch the space for AI.
Yes, I think I went for a training. That reminds me, initially where I worked before I moved to A&E, they roll out a program, call it transperineal biopsy of the prostate. Initially, they were taking the biopsies through the rectum, and almost every patient that underwent that procedure will come out infected. So this training I went for, the technology behind it is just brilliant, where they are able to take the biopsies without going through the rectum. So it's also being done as a day case without going through anesthesia. So again, it makes it safe, side effects becomes reduced, and you get a better outcome. Because with the prostate thing, they were taking the biopsies blindly, so they were not knowing exactly where they are picking the samples from. But with this new technology, it's precision points. They know exactly where to take it from. And so it also helps with in the treatment, because if they know they took it from this region, they're able to target those cells and then offer therapy. So we have not seen anything yet. A
Yes,
lot of
sure.
things will be coming out.
It's
Yeah.
just about starting.
Yeah.
Yeah, so let's watch the space for it. Thank you very much
Thank
for
you.
joining
Thank you
us.
very much. It has been an amazing conversation.
Exactly.
I'm looking
So
forward to more.
yeah,
And
sure.
thank you
We
for
will
the
do more.
invite.
That is why we are here.
All right.
Thank you. Yeah. So listeners, I know you can relate. Most of you can relate to what we are discussing. And then if you have any story, if you have anything about stress and burnout, you can share with us as
Yeah.
well. Thank you very much for
Thank
listening.
you. Thank you very
This
much.
is the Nurses Heartbeat podcast, where every heartbeat tells a story. So this is our story, and we will come your way again next time. So we are available on all social media platforms. We are on Apple Podcast, Spotify, Amazon, and then we are on YouTube at the Nurses Heartbeat. Share, like, follow us, and comment and give us a review. We want to hear from you. We'll be glad to have that discussion ongoing. So we come your way next time. Thank you.
Thank you.
Bye.